Hi everyone, my name is Stacey Lawson, and I'm here to give you an informative speech about autism. Did you know that normally autism is diagnosed in children? Also, still to this day, there's no proof that autism comes from genetics. That means that even though you've never shown any symptoms, and neither has a member of your family or your spouse, that your child could still be born with it. In 2000, the CDC did statistical research, and only 1 in 150 children had autism. When they revisited the study in 2010, 1 in 68 children had this disease. I'm not too good when it comes to math, but I do know that that means the cases have doubled since 2000 in just 10 short years. My passion from this project comes from a very personal place. It comes from someone who is very special to me, being 1 in 150. Imagine you are trapped in your own mind, just normal enough to know that you're not normal. Or nor would you ever be normal. Now imagine that person was your sibling or your friend, someone close to you that you cared about. This is what the life of a person with autism looks like. Today I would like to borrow your mind for just one moment while we discuss autism. I want to explain what autism is, how it is diagnosed, and how you cope with it. Autism spectrum disorder, or autism, is a disorder of the brain, disorder of brain development. People with autism can be nonverbal or like to engage in playful banter. They can often share traits with multiple mental disorders such as bipolar disorder, ADHD, and even schizophrenia. People make the common mistake of thinking that autism is similar to a physical illness, where everyone has the same symptoms that can be treated with a pill. Some of that statement is true, however. No two people with autism are alike. Just because you know an autistic person who is a genius does not mean that the person that you meet on the street who has autism will even be verbal. Take for instance, Temple Grandin. Her parents were told when she was 2 that she had brain damage. She struggled through most of her youth with social skills, but there was never an actual diagnosis to what was wrong with her. This woman went her whole life without knowing she was different. When she was 40 years old, she was diagnosed with autism. Now, she is a professor, an autistic rights activist, and an inventor of the hug pillow, which is a device used to calm children with autism. She was asked in her book, The Way I See It, what would happen if the autism gene was eliminated from the gene pool. Her reply was simply this: you would have a bunch of people standing around in a cave, chatting and socializing, and not getting anything done. This quote drives home what autism really is. Autism is a brain abnormality, but that does not mean it destroys your life. It just adds a little bit of interest to it. Now that we have learned what exactly autism is, I would like to share with you how it gets diagnosed. Being tested for autism is much different than being tested for the flu or maybe a type of bone disease. There's no blood drawn, no x-rays taken. Instead, a doctor studies you. Sounds kind of strange, doesn't it? I don't know about you, but I don't like the idea of feeling like I'm under a microscope. I don't like being watched, but that's the only way to determine if you or your loved one has the disorder. The only type of testing that can be done needs to be done when you are an infant, between the ages of 9 to 30 months old. It's a broad spectrum, but it's true. That type of screening is called developmental screening. It is where a doctor will check to see if the child is speaking or mumbling, check to see if it's hitting the correct milestones in the correct time frame, and also speak with the parents to ask questions about how the child acts at home. It is also very important for your child to be screened between the ages of 18 and 24 months, because that's when normally the symptoms are brought to a head. If a child shows signs of autism, they will begin extensive testing, including hearing and vision tests and neurological testing. In some cases, your normal pediatrician will call in a doctor more equipped to handle the case, such as a psychiatrist or a neurologist. After all the testing is done, you finally have an answer. Your next step is learning how to cope with this disorder. Now that we have learned what autism is and how it's diagnosed, let's talk about coping with it. This is my brother. He is my visual aid. Look at us as we stand side by side. See any difference? Besides the size difference. You can stop. Thank you. We look like a normal set of siblings to someone who doesn't know us. You know that he's a double. He is my 1 in 150. He has autism. Just because he has this disorder does not mean he lets the disease control him. Instead, he fights every single day to maintain a balance. Sure, there are some days when he fails, but it's in the days he succeeds that shows us what strength is. My brother has tried numerous medications. Some have worked, some have failed. The best way to cope with autism, according to an article written on helpguide.org, is to start treatment as soon as possible. But what the article doesn't tell you is do not shut yourself off from the outside world. Do not treat yourself as though you have a disorder that enables you to interact with the outside world. The most important thing a child who has been diagnosed with autism can do is get involved. Don't let the autism consume them. Don't let that be their life. Having autism and being autistic are two entirely different things. There are some cases where autism gets so much better in adulthood that they are no longer considered in the spectrum. For my brother, who is just 1 in 150, the best way to cope is to stay positive, keep a regular schedule, and do not let the disorder consume his life. I have learned through studying this that when somebody says autism and autistic is two different things, what they mean is, if I were to introduce my brother as saying, this is Jake, he is autistic, I'm saying that's all he is, and that's not true. Jake is more than autism. When you introduce your child or someone you know with autism, you should say, he has autism. That just means he has a disorder. It doesn't mean that's what he is. I have now informed you about how to cope with autism. Autism is a brain abnormality, but that does not mean it has to consume your life. I have now informed you of what autism is, how it is diagnosed, and how to cope with it. I hope that this information you have learned, you can now understand how important it is for your children to be tested for this disorder, and how to cope with it if your children have it. Thank you.